सो हेलो एवरीवन, वेलकम बैक टू योर चैनल। सो इस वीडियो में हम बात करेंगे इंटरव्यू क्वेश्चंस की एंड डे 2 ऑफ मेडिकल के सेकेंड डे की बात करेंगे एंड इंटरव्यू में क्या क्या क्वेश्चंस पूछे गए थे उनसे भी रिलेटेड हम यहाँ पर डिस्कशन करेंगे। सो लेट्स स्टार्ट द वीडियो।
After the eye checkup, we had to go to this doctor. He was also an eye doctor itself. Here he did a color blindness test. So from a book he told us to read some numbers. So basically that's the color blindness test which he had done. So after my eye checkup, I was taken for interview. Now this depends actually upon your number. My number was 21, so मेरा turn आ गया था तो फिर मैं गई interview के लिए. So basically now how does the interview go? Now once they call you for the interview, first they do your document verification. Now document verification basically you don't have to worry about anything. There will just be a clerk and two other M&S officers. That clerk will ask you for the xerox copies, the attested photocopies of your original documents. If he asks to show the original document just for proof sake, like, show him and put them back again. They do not ask for your original documents, just keep that in mind. They will only take your photocopies, attested photocopies. Okay. Now, the other thing what you need to remember is that if you'll have any sports certificate, or if your father or mother is working in the army, navy, air force, or is an ex-serviceman, you get marks. So he will ask you over there basically, like if you have any sports certificate and everything. And the thing is that any sports certificate, no, not any sports certificate up to 8th standard, if you have won first, second, third prize, they will meaning give you marks. If it is just a participation certificate, they don't give you marks, because that was what had happened in my case. I had taken participation certificate, they didn't provide me any marks for that thing. Even in state level, or I think so for national level, you get 5 marks, and for state level or district level or school level, you get 2 marks. Now if your father is an ex-serviceman, or perhaps he's working in the army, currently working, you get 5 marks over there. So he will ask you that thing, and you will have to show the documents according to that thing, that dependent certificate and everything, you will have to show according to that. So once your document verification is done, they will take you slightly ahead. You have to walk slightly ahead, and they will take you to an interview room. Not an interview room, it is outside the interview room. You'll have to sit in the corridors. So there will be some other girls also. So you don't have to panic about anything. So once you go in, like, I'll tell you exactly what I did. My interview was exactly 13 to 14 minutes. I counted it on my watch. Basically, what happens in the interview is that you have to knock and go in first. The interview panel people, they are very, very, very friendly. They make you laugh, and it was a very interesting, interview. I'd never had an interview like that before. So there are a total of 4 people in the interview panel. 2 are females who are M&S officers, and 2 are males. Out of the one male, he's a psychologist. Um, the 2 males, they are doctors basically from armed medical corps, because they were wearing a black uniform. So that is how I figured out that they should be from there only as such. So they ask very friendly questions. You don't have to worry about anything. So basically, the once I came in, they told me to sit, and they asked me, "What is your name?" I answered. Then after they asked me, "Where am I from?" I said, "I'm from Goa." Then after this, they asked me, "When did you pass out your 12th standard?" I said, "I passed out my 12th standard in the year 2020." Then they asked me, "What did you do for 1 year in the year 2021? What did you do?" I said, "I'd taken a job for M&S preparation." Then later, they asked me the question if I had answered NEET. I said that I didn't answer neat. I didn't answer neat. I said that. Then later they asked me why you didn't answer neat. Then after I said that my elder sister, she's already a doctor, and so in the family we already have one person who can um, diagnose the disease. So now we need another person in the family who can administer the drugs. So when they heard this thing, they started laughing. And then later, one of the MNS officers, she asked me why can't a doctor administer drugs? So then afterwards, my answer to that was that of course a doctor can administer drugs, but his main job is mostly diagnosing the disease. So she's like, okay, fine. Then after that, she asked me, meaning the other MNS officer, she asked me if there was any nurse in my family. Then I said no, there wasn't any nurse in my family, but my grandmother was a nurse. And then after she said, did you see her serving and all? I said no, ma'am, I didn't see her serving and all. Then later they asked me the story of Donna Paola. Now, Donna Paola is basically a place in Goa. So this was a question related to state, my state. So y'all need to see if there is any meaning, some place in your state who has a story behind it and give that answer. Okay. So basically, I told the story behind the place named Donna Paola. Then later, they asked me the question, which Goan sweet is made out of coconut milk? I said bebinka. Then afterwards, she asked me jokingly, why is it so costly? Then later, then later, I said that, because it's a very tedious process, and each layer it has to be baked separately. She's like, okay, very good. Then later, they asked me this question, which was really very out of the blue as sort. I had not expected this question. They asked me this. They asked me this question if whether I drink alcohol. Well, then I was like, now I was like shocked in the first place that they asked me this question. This question was basically to test if I am telling the truth, if I'm a truthful and honest person. So basically, I said that no, I don't drink alcohol. And they were like laughing and laughing and laughing. Basically, they could not believe that a Goan person is not drinking alcohol. Then, after they asked me this question, why don't you drink alcohol? Well, I told, ma'am, I'm only 19 years old and my parents are also very strict, and I'm not a big fan of alcohol. I said that thing, but I do taste. I taste in little quantities, just tasting. Then she's like, okay, meaning you drink now. She was like that. I'm like, yes, I drink, but it's very little, very little. She's like, okay, okay, fine. Then later they asked me about Caju Feni. So I told that it is a local alcoholic beverage which is made out of the juice of cashews. And then afterwards, one of the doctors, army doctors, he asked me, how does cashew feni taste? Then afterwards, I'm like, it is a very strong liquor. Then he was like, yes, it's very strong. He was like that. Then later they asked me this question, that why were the COVID cases so less in Goa? I replied to that the Goan population is very less in the first place. As a result, as a result, the cases were low, and the other reason why I told was that the medical facilities in Goa is much more better as compared to the other states of India. Then they told like, give me one more reason. They were like that. Then after I told that also Goan people, they followed all the criterias of wearing mask, using sanitizer, maintaining social distancing and all. So they were like good enough. And then yes, with that I think so my interview session was over and they told me to leave. I thanked them and I left. uh, After this, now my interview was over. So Yeah, after my interview was over, I went for my ENT process. Yes. When I went for ENT process, it was a very meaning like easy process kind of process, nothing to panic, nothing to worry about. It is like basically there was this doctor. She kind of put like a long kind of like a long pipe kind of is i- in instrument which had a torch at one end, and she put it in my ear and she checked basically. Then she checked my nose, meaning she slightly pulled my nose on top and she just checked it with a torch to see if I had deviated septum basically. And then she told me to open my mouth and say ah, meaning stick out my tongue basically so that she could see my throat. So after this was done, over here basically, if like sometimes some of the candidates in my batch, they had ear wax in their ear. So the fourth year MNS students, they come and tell you, meaning they pull you on the side and they tell you slowly, go and get your ears cleaned by some private doctor and come tomorrow next day, we will do your ENT again. So these meaning like they were very helpful like that. They used to tell like basically. So after ENT was done, I had my surgery. Surgery process was there. So in surgery, basically, yeah, surgery meaning like they took three girls in the room at a time. It was a female doctor and the MNS officer was there along with us. We had to remove all our clothes except the underwear, rest everything you had to remove, and she will tell you to lay on a bed, lay flat on a bed, and she will check if you have breast lump, meaning she will palpitate your breast. There is nothing to feel shy about. Okay, so she will palpitate your breast and she will check if you have a breast lump. Then later she will press your abdomen and she will tell you to look towards your right hand side and cough. You have to cough basically, and she will meaning press your stomach and she will check something. I don't know for what it was, but she told me to do that. I did that. Then the next thing what they told in surgery for us is we had to stand straight with our palms facing outwards. So basically, this was to check the angle of your hands, the critical angle, some angle of your hands they had to check if they are well aligned and all. Then later they told us to jump like about 6 times. That is basically to check our balance, and they also told to stand on your toes. These two things were basically to check your balance. Then the third thing what they told us to do is walk on your toes. You had to walk on your toes. That was also I think so to check balance only. And then they told to walk normally, just back and forth, walk normally over there. Then they will tell you to stand straight. Here they will be checking for knock knees basically. You just have to stand straight. Don't try to spread your legs too much, or don't try to bring your legs too close. Just stand straight normally जैसे तुम लोग खड़े रहते हो, सीधा खड़े रहो. She will check it. And don't try to hide anything and everything, because she's a doctor. If you have knock knees, you will be caught. If you don't have knock knees, well and good. So don't try to manipulate basically. Just stand straight and she will check if you have knock knees and everything. Then she will tell you to touch your fingers to your legs, meaning bend forward basically and touch your fingers to your legs. So then later she will tell you to l- show the sole of your foot, meaning to check for flat foot basically. You have to show both your foot, and she will tell you to show your hands, meaning show the palms of your hands, and meaning your nails basically they are checking, meaning okay. So these were the things basically what they did in surgery. So after all this process and everything, um, everything got over on the first day at 3 o'clock, 3:30. So now over here, On your first day, it is a very tiring process. They will make you run around a lot. You will get shouting from all the MNS officers because they are very, very, very strict. Please, please, please keep your booklet neat and write with capital letters, blue ballpoint pen. No black, no green, no any other colors, only blue ballpoint pen, capital letters. Otherwise, they will scream at you. They shout a lot. That is just to test you, basically. That is also another test, I think, so for us. Okay, so with this, at 3:30, we finished off our first day. So now I will tell you about the experience of my second day medical and interview. Um, the second day was not as hectic as the first day, and we only had to do two things. That is our medical and dental, and then finally in the evening was the medical board where we had to go. First of all, we were told the previous day that we all had to gather outside the auditorium at 7 o'clock in the morning. So we all the candidates who had appeared the previous day, they had all come near the auditorium. So at 7:30, an MNS officer, she took us inside the hospital, and she basically divided us into two groups. Now in one group were the students who hadn't done their surgery, because in the previous day there were some students who hadn't completed their surgery. So they were kept separately, and those students who had completed everything so far, they were kept separately. So after this, we had a brisk walk to the Army Dental College, which was not so far away from the Army Hospital. So over there, we basically had to sit for some time, and then later we were called in by the dentist. So first of all, when we went uh, inside the dentist room, we were told to gargle our mouth, and meaning basically cleanse our mouth, and then afterwards go to the dentist. Once when I went inside, he told me to sit on the dental chair, and he basically just checked my teeth. Over here, they basically check for cavities, they check for extra milk teeth, and they check if you have 28 teeth basically. I don't think so there is a problem with gap. There is a gap between your teeth, or I don't even think so if you have a cap over your teeth, it is they will tell you rejection basically. I don't know, but I'm not sure. When it was my turn, I went and I sat in, and he just checked, and he told his assistant 28 teeth, and he told me to go out. So my dental was very easy kind of such. I just want to give you all guys a piece of advice. When you're going for such kind of medical, medical stuff, it is always much better if you just have a medical at your home, like in your home state. So when before going for to New Delhi for my interview and medical, uh, though I didn't have enough time to complete all my meaning like go to the dentist and all, I still made time. So I went to a dentist when I was in Goa, and I just told her to check my teeth, if there are any cavities, or how is my bite, do I have 14 points. I um, i i explained to her basically that I was going for Indian Army, and these are some certain dental criterias which I need to have. So do I have those? So basically, she checked my teeth, and she's like, everything is fine. I only had two small cavities. Then afterwards, she was like, it is better if you rectify the problem when you are in Goa itself, rather than going in Delhi and then after getting medically unf unfit and all. So I felt it was wise enough to have my cavities done in Goa itself and not take any risk, like, basically. So I did my those two small cavities. She checked my bite. She said your bite is fine, no problem, no problem with your bite. And then she checked if I had 14 points. She said yes, you have 14 points. So basically, even when I when I was in Goa, I had gone to the ENT, and she checked my ears and everything, and she's like, there is no wax and everything. She checked my nose if I had a deviated septum and all. So and my throat also she checked. Since my sister, she's a final year MBBS student, so I kind of got these things free of cost, like. But meaning, like, all this appointments with doctor and everything, I did it in Goa Medical College. I had done it over there really. So meaning, like, it was easier for me, and you will be much more relaxed during your real medical in Delhi. So that is just a piece of advice which I want to give you all. Just visit the dentist or ENT or your eye specialist, whoever is there. Just visit and just have a check when you are in your own state. Okay. Okay. So coming back to the medical, after this was done, we were told to walk back to the army hospital, where the students who had not done their surgery, they were told to do their surgery first, whereas those who were done with everything, we just had to sit. um, Next thing which was done to us was medical. Okay. So over here there is a fourth year uh, MNS cadet. She tells us to uh, she checks her height, she checks her weight, and she tells the doctor. Okay. And then later she checks our chest expansion also with a measuring tape. Then after, the doctor calls you, and he tells you to sit. He asks how old are you, and he asks the MNS cadet for our height and weight, which he jots down. And then after, he looks at a BMI chart, basically, and he writes it down over there. Then he checks your heartbeat. He will take the stethoscope, and he will just press it against your chest, and he will tell you to breathe in and breathe out. And once that is done, he will tell you to go. So this was what exactly happens in medical. Now after this, we had nothing to do. We were just told to sit over there. We sat for quite a long time, while, I mean, the all the other MNS cadets and the MNS officers, they were busy in the paperwork and making our medical booklets ready. Okay. So at, like, around, like, at 5 o'clock, um, they called each one of us separately inside the medical board room. Okay. It was headed by a Air Force doctor, and there was also a MNS officer in that room, and there was a army, the wait, she was of uh, Army Medical Corps, yeah, because she was wearing that black color uniform. That is how I figured out. So when I went inside over there, he told me to sit, and then after, he asked me this question. He asked me, like, "Do you think you are medically fit?" Then after, I said, "Yes, sir. I think I will be medically fit." And then after, he was like, "Congratulations, you are medically fit. You may go out." He's like that. So now, in my batch, out of the 35 students who had appeared for medical and interview, only 10 students were completely medically fit in the first go itself. The remaining students who were there, they were given temporary rejection. So actually, meaning, like, after, I asked my friends from my batch for what did they get temporary rejection and all. So once everything was done, the students who were medically fit, they told us you can go home, whereas the students who were medically unfit, they were told to stay back and they were told to fill some forms. Now those forms I have no idea, but I do know there were some MRO forms or something, but I don't have such a deep idea about that.